perfect timing. We're going to kick off this session, and Dan O'Brien, as you've seen if you were at the opening speaking event, is going to kick us off.
All right. Good morning, everybody. So I will admit, I am not an expert in early education and child care anywhere further than I have a 7-year-old and 4-year-old. So I will not say very much substantive here, but I do want to welcome you all, and I want to express how excited we are to have you and have this conversation occur here as part of this day. We're really committed as a center, as a consortium, to the idea that we should be engaging with and supporting with all domains of daily life, everything from transportation to, there's a reparation session going on downstairs, there's one on climate resilience going on in there, and early education. So historically, right, our commitment is really to the idea that there's this power if we can intersect the, I think Chief of Staff Tiffany Chu put it really well, that academics have the privilege to sort of blue sky. They have the privilege to ask whatever question we want to ask. But sometimes we need to be told what question to ask and what question to answer to find it. And so we're really committed to the idea that needs to come together with all of the constituencies that know what question needs to be asked, that know the problem of implementation that happens after that question is answered, right? And so really, kind of with Kim's kind of fearless leadership here, the hope is you guys are able to have that conversation today and think through what are your priorities, what are the kinds of questions that stem from those priorities, and then how do we leverage sort of the human capital, the intellectual capital to help answer those questions and to help have impact and to support your sector and the families and young people that you all serve. So with that, again, thank you so much for being here. We're really, really excited to have this conversation be a part of the broader conversation. And I hope to meet you all around during the day. Please come say hi. Tell me what you do. I'd love to hear, because we're always excited to have more new faces here. So I think that's it. Is there anything logistical you want me to share with people? Or?
No, I think I'll cover that when I talk.
All right, that's good.
Cool.
All right, well, thank you again. Have a great conversation. I may flip back in to watch a little bit at some point. But yeah, have fun.
Thank you. Cool.
Thank you.
As Dan mentioned, thank you all for being here. This is a session where I, as an academic, I'm Kim Lucas, I'm a professor of the practice here at Northeastern. I'm an academic, but I am actually here to play a role of facilitator as opposed to anything else today. I'm facilitating, uprooting your expertise, and that's it, right? So you are the center and focus of what we're doing today. I'll get into it. We'll talk about step by step what this session is about. It's about early childhood. Great. What else? We'll get into that. But before I do, I want to introduce my colleagues at Strategies for Children, who are co-sponsors and partners for this session. And so maybe Amy, Marissa, and I don't know if any of you, Amy? Yeah,
I'll come up. Hello, Zoom. We learned a term this morning, on the ground. So we are on the ground and you are in Zoom. It's great to have you here. I'm Amy O'Leary. I'm the Executive Director at Strategies for Children, and we are a statewide advocacy policy organization that's working to make sure Massachusetts invests the resources needed for children birth through 5. And we're so excited to be partnering with Kim, who we've been a longtime fan of, and we've worked in partnership over the years. But we are really excited for today in the way to kind of get into the space and the experience that we're going to have facilitated by Kim. We've been doing some work at Strategies through the pandemic to really think about the voice of the people who are doing the work every day, connecting that to policymakers. And one of our most significant lessons learned over the last 2 years is we typically thought of like putting on the dog and pony show when we went to go visit elected officials, even when we talked with commissioners or other policymakers. And what we learned through our daily 9:30 call, which we started every day of the week during the pandemic, was that this unvarnished, real talk express was much more helpful to policymakers. And we could see the fingerprints of the feedback from the field in the policies that were created and then sometimes revisited to think about what the decisions being made in, we heard about the academia or the kind of government office and what the implications were to people on the ground. So we are so excited to think about this as we think about our future as an organization. We have always believed in data, both qualitative and quantitative, and know how hard it is to get both. But our strong belief is that the people who are doing the work have to be part of the solutions. And I know we're going to talk about problems today too, Kim, but we also are very interested, and that's what we hear over and over from elected officials. We believe they get it. They understand the research. We don't have to convince them, but we do have to convince them to shift their priorities, to think about how we really are going to build a system for young children and families in Boston and across the state that is reflective of the work that we know is so important that's going on the ground. So we also at Strategies have had our Advocacy Network, where we have 9 individuals from across the state who have joined us. And we have 2 of our members here today, which we're so happy to have, Hung and Gloria. So thank you for being here. And we're so excited other people came too. So I'll turn it back to you.
Great, awesome. Okay, so I was here to do the what, right? Like, what are we doing here today? This is a conference, y'all know that. This is a data conference, y'all know that. And it's a research and data conference. One of the foundational places when we talk about, when we get to data and research, right? Before we even get there, we have to know, what are we asking? What are we using this data for? Who are we asking to help us do research on these topics? What's the what? And that's what we're trying to surface here today. Pardon me, Zoom people. We're going to move you over to the side a little bit. Sorry. There we go. Okay. And I'm going to share my presentation here. We talk a lot about civic research agendas, and that's a term I made up. I'm not even joking. In 2018, I worked at the city of Boston, and there was something called the Civic Research Agenda where our academic partners said, City of Boston, you do a lot of stuff. I don't know if you know that, but y'all do a lot of things. Can you just tell us your priorities so that we know as researchers, as nerds, do we fit? Can we help you? Or is that not something you need right now? Because if it's not, we'll step back, we'll go do our thing, and you let us know when you're ready. But if we can't tell what your priorities are, then we don't know how to work with you. We don't know how to support you. And we did that. There's a version of that floating out there from 2018. And right now, Bari, I'm now part of Bari, no longer the city of Boston. And the idea here is to say, can we do this? Is it possible to do this with communities who care about a specific issue, instead of working with local governments? So the question here is, can you, as the early childhood community, identify your collective priorities and communicate that out into the world and say, collectively, we believe in Boston. These are our top 1, 2, 3, 5, 10, 15, however many priorities there are. But the number 1 thing you should start with is this. The number 2 thing you should start with is this, or these 2 things you should work on at the same time, right? Just articulate them so that folks who might have supportive like networks, resources, whatever, can say, oh, that's what you want us to work on now? Got it, we have these things. So that's the idea behind this. The Civic Research Agenda is both a process, so it's a way to engage people in identifying and articulating their priorities and needs. It's also a product, and sorry, Zoom people, you're sitting on top of the product. It's basically either a website or at the city of Boston, we made a little book, right? That was just our list. This is it, this is our list. And how did we use that product? We brought it to meetings and we said, you don't know where to begin to partner with us? Here you go. Which one are you interested in working on with us? Which one gets you excited and motivated? Which one do you have resources behind? Let's start there, right? It's always hard to jumpstart projects. And so like, that's just a way of being able to do that. Today, this process is 4 pieces long, as we've decided it should be. I don't know, we'll figure it out. Maybe it's not 4 pieces long, but we're starting at step 1 today. What are our priorities? At some later date, and I'll give you the preview, if any of you are staying all day today, then the housing session at the end of the day is actually gonna do step 2 of their process here at Bari. So we don't know how that's gonna turn out, but if you want a little sneak peek on what that could be for this group, come to the housing session, just take a look. see what that process looks like and how they do it with housing. So we've done this once before with housing. We've done this on a larger scale before with the city of Boston. This is an experiment here. We're trying to figure out, is this a thing that's useful for the early childhood community? So that's kind of where we are. What are our collective priority issues? Before we start, so we're gonna have 3 sections today. The first is introductions. Who's in this room? Who are you? We're gonna get to our priorities, and then we'll do some next steps from there and just kind of ask you all what you thought. To kick off introductions, and because this is such a large group, and because we have some Zoom folks, I'm gonna send all of you Zoom folks into a breakout room, and for 5 minutes, we at our tables are going to do some introductions. And I'd like you all to share, who are you, what's your name? The organization that you represent, if you do, your pronouns, if you would like, and then what brings you here today? Like, is it a person? Is it a motivation? Is it a wish? Is it a hope? Is it anger? Is it a feeling, right? Like, what brings you here? All of it, right? We want you to bring your whole self to this. And so I'm gonna give you about 5 minutes, and Zoom folks, sit tight. I'm gonna put you in a breakout room. And you all can do that there, and we will do this here. We will sadly not be able to join you, Zoom folks. I'm afraid I keep looking this way, but the camera's but okay, go. Yes.
Hello. Good morning. I was admiring your dress. It's great. My name is Claire. Hi. I'm volunteer here in Boston. And my pronouns are she, and I co-lead strategy software and and we're doing an assets and opportunities assessment with our school community. Not a needs assessment though, it's similar to a needs assessment, but we're trying to be very asset-based in our approach. And so the results of that assessment will be sort of like what informs the priorities of the school community, which will inform the work of my staff who are on the ground in the schools. And I'm not a researcher, and I'm supposed to lead this whole thing and get all of these community asset assessments done. And so so we want Bari to help, and so I heard about this event happening today, and so that's what
Say that one more time. You'd love to see the subscribe.
Second story. Oh, wonderful. Congratulations.
I am the director of and besides being
thank you. And so my
help.
So I don't like
My name is Lisa. She's our agent. It's the organization for huge federal grants that we receive around family resiliency and how to build that family support. It's a demonstration grant from the Administration of Children and last year at the same time. So we're trying to piece together this great funding, how to bring supports for families, and always thinking about kindergarten readiness, what that really means is there's a lot of social determinants of health indicators that we need to pay attention to. So my background is in public health. So I'm a PhD student at the School as well, because I'm crazy. No, I actually like slept like 4 hours last night, so I may not be coherent today. But I am pretty obsessed with care and obsessed with foster care and how I'm a foster mom as well. I have my life daughters. And you know, just trying to piece together how to figure out like what is it that families maybe like tailor the approach. We have this program, but I'm building it from nothing. Like there wasn't anything there. I'm trying to like coordinate the process. Yeah, PTA, schools, trying to figure out like let's not work inside. Like if I have the money, I'm gonna subcontract with people to do the story time. Like I'm excited to talk to all of them. So we have like 4 social childcare centers at the social centers. That's not really enough, you know, for 650, 700 folks in the spots.
All
so
right,
I'm definitely a
this
numbers
is the
person.
1 minute warning to wind
And I
us
worked
down.
at MD Chelsea for 4 years, so I'm very familiar with refugees and immigrants and trying to figure out like so I just know that there's so much I can find what I can do. I'm one person, I'm trying to build a team and I'm trying to figure out like where can I bring the expertise to be able to help you. It's not easy to find talent. They're not excited about it. I have apricot dance. Many of the parents don't want to use it. They're like, no, I did not go into this program, you know, to do that. They speak 8 different languages. They have a lot of expertise. They do not like it. Even though I'm like 7 years ago. So I practice with my we like talking to families. But then I feel that I'm not but then like the wildflowers so Joey is part of the child care coalition that I started with
All right. Welcome back, everybody. This is a fun thing. We're like, welcome back. It's like we're on Zoom because they're back from there. Hopefully y'all have gotten the conversation going, a little wake up discussion, right? Got the juices flowing, feeling good? Yeah, okay, good. Okay, we're fired up, we're riled up. This is the part where we're gonna do some priority making. And what this is, to be honest, is a consensus process, right? Love a good consensus process. A little community engagement consensus process. So, I'm showing you my cards here. So we're gonna do this by first, you've got some note cards in front of you. Zoom folks, you have, it looks like y'all are sharing a Jamboard. They're very entrepreneurial. Wow, look at that. And what you're gonna do is by yourself, okay, by yourself. This is not a group thing yet, but it will be. By yourself, I'd like you to take 3 of the note cards in front of you, only 3. And there's Sharpies near you. You can use your pens, however works for you. Use a writing implement to write for the group you're here representing. So not you personally, although it could be you personally if you aren't here by yourself, but for the group you're here representing. What are your top 3 priorities? What are your top 3 issues in early childhood that you'd like to see addressed? And let me make this very specific, that you think data or research can help address. So top 3. Don't have to be in any order, but they do have to be your top 3. 1 on each card. And then we're going to do something with the backs of the cards. If you need a new card, I have many cards.
No matter what side we've written.
Does not matter what side. That's where you can go rogue. Line or unlined. Lots of choices.
With four things over 3 cards, or with the same thing over each card?
I'm sorry, what did you say?
There's 4 things on each card?
So 1 thing on each card and only 3 things.
Oh, okay.
Good question. Just in case this is helpful, I'm going to give you my roller derby example. I used to, some of you may know this or may not know this, I used to do roller derby. 3 issues in roller derby were recruiting new players, business management, internal politics and culture. Ooh. That's it. Nothing too wild. 3 issues that you'd like to see addressed by research or data. I'm surveying the room for thinky faces or done faces. So when I see the majority done faces, we'll move on, but take your time. Okay, next step. Again, you're going to do this by yourself, not as the group project yet. We're going to take each of our cards, and on the back of your card, you're going to flip it over, whatever the back is. And I want to ask you, okay, but so I asked you what the biggest problem, what the biggest issue, what the biggest thing, priority you have. Now I'm going to ask you, what's the real issue? I find that you have to ask this at least 3 times. So on the backs of your cards, I'm going to say, no, but really, what's the issue? And I'd like you to break down that issue into, I give you 3 here, I'm going to say 2 because the size of this room is big. So I'm going to ask you to write down 2 sub-issues. So for example, when I said roller derby business management is one of my issues, actually, my issues are, well, should we be an LLC or be a 501c3? But also our issues are, well, we should make our dues structures more equitable, or also we should find a way to recognize our volunteers, right? Like those are, when I say business management, I actually mean these things. So we gotta break them down into our sub issues. So what's a little issue underneath your big issue that is actually the real thing that you want? For example, I hear a lot of folks saying the workforce, we need to do something about the workforce. Okay, that's good. But what do you mean by that? Do you mean we need better compensation? Do you mean we need better supports for people who are already in the field? Do you mean we need more people in the field? Do you mean we need assistance for family childcare providers? That's really specific. What do you mean when you say the workforce? 2 things on the back of each of your cards. Okay, I'm going to interrupt you. Let me give you half of my example. I love surprises. Not everybody does. Okay, so we went from big picture to little picture, but I'd like you to frame this as an issue or a problem. Humans have a tendency, especially humans in this space, I'll say that, have a tendency to want to jump to the solution. So for example, I told you that these were my 3 sub-problems here. Actually, these are not problems. These are solutions. The real problems are, oh, not do we need to be an LLC or become a 501c3? It's we need a sustainable business structure. That's the problem. The answer is figuring out which structure, right? The problem is not making a due structure more equitable. The problem, that's the solution. The problem is retaining people of all income, right? And finally, the last problem is not recognizing volunteers. It's actually that volunteers feel underappreciated. So we have a tendency to jump to our solutions before we've said what our problem is. I would like you to look over your sub areas and feel free to revise. Again, if you need a new card, got plenty. But make sure that you're framing it as what the problem is, not what the solution is. All right, I'm gonna give it a minute more to wrap up. Do a little revising if you need to. Check the email if you need to. Send a Slack message if you need to. Tweet out how awesome this is if you need to. At KDLucas04. Okay, we're approaching interactive part. I want you to take a look. So you should have 6 mini issues, 6 sub issues on the backs of your cards. And then now they are truly problems, not solutions. I want you to pick your top 2. You're going to put them into a big pool and bank. We're going to pool them together. So pick your top 2 that you think need the most work, that need the most data research help. And I want you to pick 2 of your leftover cards. I gave you 1 extra card, so have a free card. But I want you to transfer those 2 onto 1 card each. So just your top 2, transfer it onto a fresh new card. And if you need new cards, let me know.
Is this the first problem or like the sub problem?
Sub problems. Top 2 sub problems. Transfer those 2 each onto a new card. And then when you're ready, whose table can we use? Can we use this table? When you're ready, we're going to bring your top 2 cards over to this table. And we're going to huddle and stand around this table at a respectable distance. And we'll do a thing together, but only when you're ready. You have your top 2 transferred over. Yes.
So we've got 6.
Yep.
Top 2 out of 6.
Out of the 6.
Okay, got it. Understood.
Yep. It's not that they're not important, right? It's just that we have to figure out which ones are most important. Cool. Okay, Zoomers, we're going to try to bring you into this group. So if you can copy paste your top 2 into the chat. Oh, sorry. If you can copy paste your top 2 into the chat.
Can you hear me?
Then we will include your top 2 on this table.
Kim, can you?
Sending
Yes, I can hear you.
Yeah. So we're doing it.
I was doing a conference half on it.
So I think my question is the individual top 2. Never mind.
This one is 1 card.
I also am not wearing my glasses today because I'm vain and don't like how I'm like not the best at representing myself. And I thank you. I know Taisha sent me another email about yes, and I will send the contact info.
How you doing, Rosie?
But do you know when this topic?
Yes. I saw you writing small and red details.
Because technically we were awarded it November 22nd.
We have no
In the fall. I like that extra. I was your hair so long. I know it is. I was thinking about you because I'm used to volunteering. Well, if you have an opportunity, perfect. So we're going to something or something. I don't think it's like a hard task. Okay. Yes. Perfect. She's already done a couple of things that I think like she well, even Thursday nights. I'm done with work around 4:30. Oh, perfect. Okay, please do. I'm like, yeah, I love that. My sister Echa, I'm excited. Like, Ella who sent me the original information. She's also like a public school teacher. And I know you're not. No, I'm a family child care. Yeah. So she's a third grade teacher at the summer. And her and I, you started a program. Her and I do volunteering on Fridays. I don't work on Fridays. And but I was just a little bit crazy because I saw somebody's bumper sticker, Meals Not Legal, and I was like, literally thinking, I was like, because I was like, you look so familiar, and I was like, is she a therapist? But yeah, send it to me. I would love to.
All right, we have mostly our top twos over here.
Versus getting the Zoomers.
Marissa and Riley are getting the Zoomers. Okay, while we are transcribing those, I would like all of you to come here, and your first task is, do any of these go together, or are these completely different priorities? That's the question.
To avoid COVID wise, everybody crowding around, could we maybe do it? Could you read them so everybody's crowded around together?
Oh, yeah. Oh, okay. I mean, you want to help me read some of these? All right, we've got improved wages for childcare and early ed workers, increased system capacity, more childcare, early ed seats.
K-12 public education mindset, irregular non-9 to 5 parent work schedules.
We have inequities in skill building, knowledge acquisition, and distribution of family supports. Identifying all equity-related data that lead to inequalities.
Lack of knowledge of effective and available services, understanding what families want.
Demand for childcare exceeds supply. Resistance to change. Transfer of power to the people.
Yeah. The revolution starts now. Affordability and access to early childhood education, including resources, population displacement, gentrification, finding the right calculators and researchers who can address your needs.
Affordable childcare, support for family childcare programs.
Expertise of staff at childcares, dumbing down, lowering expectations for students of color.
Lack of parent involvement in decision-making, challenge of making and measuring long-term family outcomes.
Someone after my heart, a run-on sentence. For 2, ensure that early childhood education and providers are at the table and transferred in something planning the circle that lacks transparency does not actually deliver the access and services. Biggest issue, cross-training between early childhood educators and youth professionals so that each discipline understands the others and their work.
Lack of free high-quality programs for 3 to 4-year-old children. And the school/program registration process is too complicated for parents. Evaluation of existing playgrounds, need to better understand what families want and need from early childhood seats and settings. K does not allow researchers to stay, and not everyone has a feminist perspective. Okay. How can institutional partners and government officials better follow community leadership around early childcare needs? People don't want to do research that will upset folks. How do we get commitments from leadership? Data collection, metrics, visualization, and sharing platforms are inaccessible to many community members.
How can we democratize all stages of data collection and sharing? Create an outreach strategy to engage different communications in the data collection process. How can we communicate funding in an engaging way that creates a sense of urgency among different stakeholders?
Cool.
We've got a couple more. Want me to read them off?
Yeah.
So we need a city level steering committee to create a shared definition of KR at the system level. We need systemic barriers that lead children to not being kindergarten ready. How can we create a city level steering committee to create, how can we create a city level steering committee to create a shared definition of KR at the system level? Can we map systemic barriers that lead, I already read those, I'm sorry. No, I think they're just being copy and pasted.
Yeah, sorry, I was rephrasing them as questions.
So I think the way we're going to do this is, for those of you who are comfortable, we're going to need to figure out a way to group these if they can be grouped, and then prioritize them. This is the consensus process. What are your top, I don't know, you tell me, how many do you want? Top 1, top 2, top 3? But we still need to rank some of these things. So this is everyone's, including the folks online.
Maybe 3. I heard trends. So
yeah.
I feel like there's at least 3 main.
3 is good. Okay, let's find our top 3. However we do that, I cannot tell you. You all just have to come to a consensus. And go. Also, Zoom folks, if you want to speak, so Zoom can hear us, but we can't hear them right now. So Riley is over here watching the hand raises, and so Zoom folks, if you want to speak, we have to do a little dance over here so that we can hear you. But you can hear all of us and how we deliberate.
I heard like a fourth. Okay. I feel like I heard about like low voltage. Okay. So internal maybe.
So I'm just
Folks can come over.
Yeah, there's space.
Yeah.
No, it was one about the, we said, we were talking about that. I said, like, when I put top 2 makes very. But, you know, he said this is why I think we need to get this Wendy, also there. I was just down there and it's at the complete opposite. Oh, I guess I go look. Yeah, it's not like right here. He just does it every 5 years.
I know. It's like policies, not solutions.
Research related evaluation.
Yeah.
So I made this one. Might not be perfect.
Okay.
Thrust behind that.
Yeah. Okay. And
Those
it's
two
on
were-
all equity related data that to
Thanks for your help today. Is the student here? No. Okay.
Yeah.
Just on the staff?
Yes.
This is sort of more into like affordability /
Okay. Yeah.
Oh, yeah. Affordability, access to quality care.
Yeah. Well, that's
No, for individual.
Oh, we have three parking, we can merge. Yeah.
Well, so when you have that, start thinking about this just affordability, engagement. So is that, I was saying, that's usually.
Yeah, so it's actually probably the way it is. Yeah, we don't want to.
What if we reach the most people that?
We weren't sure what to expect. We trust Kim, we've known Kim for 12 years. She is an early childhood expert, but she's more a civics research expert. She knows how to think about things. So do you think this is something that would work in a different setting, like at a conference with educators, families? Good. This is the first one we've ever done. Right. Well, she said that it's part one. So in the future, we may plan a part two. And another day, maybe on Zoom. We will also take the results and think about them too, how they inform what we do with them. Yeah. It's like the census is one way to do that, but there's got to be other ways, right? A list of priorities, you can do a letter or a meeting or some other kind of format, video. Wendy helped write the survey too. So even though it's from the city asked a group of people for feedback. Wendy and others gave feedback and input to make the questions better. Last year for the previous survey, graduate students at Wellesley College, graduate students to help count all the results. There were a lot of paper surveys that they had to And, you know,
Should I make it?
so yeah, she's very involved in these kinds of projects. Fernanda too, so Fernanda's on the Zoom, she couldn't be here today. She wants to have a good yeah, you love her. You know, she was like, now she's at the city, so they have a different interim director.
Does everyone in this room agree that you would
Call on
Oh, there's no way.
The Zoomers actually went rogue and did their own thing, so just everybody else. Good. Gloria, I know you were not there.
Yes, well, did it get shifted?
So it became groups and then we had to get down to.
Okay.
So.
Okay.
And we didn't put them in like in order, right?
Yeah, okay, well, these are the top three. Okay.
In order?
They don't have to,
Anna
if
can
you want them to.
I don't think.
Okay, yeah.
I'm gonna get coverage.
Yeah,
That's two other educators.
Everything there. We've got a top three, would you agree that amongst these?
Yeah.
So these would not work.
Those kind of nailed
Felicia, I saw.
Whoever did those three.
Exactly.
Exactly.
I think she's sick.
So it's sort of.
She's gonna try to come to.
Oh, well, we gotta get you on board, we gotta get you on board. Y'all have to get Wendy on board.
There is other card.
We try to influence, go ahead.
Please. We have.
I think I put some here.
Good. I get so like kind of tired when I have to it's like.
Where do you
South Coast,
Bedford.
Okay, yes.
So, you know, leaving 7:30 to get there by.
Yeah. Especially that traffic on Bedford.
New Bedford.
New Bedford. Yeah. I don't live too far from here, but I like sleeping on Fridays.
Yeah, right.
A day off.
You have to feel good about
Oh my God, I stay in bed till like 9.
After the lunch, you know, you can go home.
Exactly. I'm taking a nap.
Where is it? So it's in New York. That's great. I've never been there.
With this drive station.
So I would say they're related.
Yeah. But maybe it takes a while. I trust it.
To me, that's a crucial.
Yeah. Supports and this one, we don't have enough.
Yeah, I was thinking that same thing about there's no need to just from it.
Yeah.
So we like that. Do you, like, you feel like, feel that the retention of staff and like, we're talking about quality of life.
Yeah, when I made this, like, like just.
There are.
Yeah. Yeah, but I wouldn't assume anything. Yeah, yes, sir. Like my secret friend, it's in my.
That's my own qualm, but otherwise I agree with Oh yeah. Honestly, that is a great one. I would say that to be that is the foundation. Right. Yeah, no, exactly. So I think that's the to me, it's a lot. I think that's part of our before. That's why I also like that. That was going to be my comment. There wasn't without that, there wasn't really oh yes, but even irrespective of all that, I agree with what Aaron would say. Yes, and I put informal something like informal childcare. Actually, it did make it to my top. Actually, no, the regular work schedule is kind of really gets into that. How there's childcare from all different things.
Right. One of my problems is that someone needs to have experience on dismantling entire childcare.
Well, that's the. I mean, that's the we want to zoom way up. Now we yeah, that needs to be specific.
But the top problem, right? Again, these are all problems we will work on. But what are the top three?
I want to dig into what you said about grandparents and what they're central based care, like something about what families want is it being met, right? And that could be like maybe they're getting care with their grandparents, or not. Maybe their grandparents could be Mr. Family. Sorry, personal again. But like, how do you figure out? I mean, it's, yeah, I think it's the plan to get this. We get what they want.
I think we don't have the true understanding.
I think that's kind of what this is. Yeah. Yeah, so that's why I think I really like that.
Early childhood environment, not just childcare, it's not just mom and dad.
Yeah.
At the same time, so that economy not also the
So that's so I put the K-12 education mindset. That's kind of what I was also like. It's definition of what is a child in terms of public good, like 0 to 4, public good, and that's just a collective. It's like our paradigm or dysfunctional properties.
Transportation back up.
I mean, we're close. We have 4.
Yeah.
I mean, it's 3, right?
To be fair, you all decided that it would be.
So
I did not tell you.
Yeah,
that.
true. We could have some scope for you. Just letting stand just a little bit.
Like this to me, though, I would agree. I probably don't have for children and then for child. Yeah, that's
And then this one is, and then yeah, of course.
I think there's a lot.
What is that?
I would still favor the demand one if I were to choose one personally.
Yeah, like demand for free, high quality programs.
Yeah, right, something like that. Yeah.
And you know, all the different groups that we looked at, and no one ever said it's going to be free, it's going to save up parental income. So people are saying like, yeah, of how much you should pay the child.
Well, that, I mean, so then you could say that that makes the same subsidy system or something like that.
Right,
versus
right,
for everyone.
right.
Oh, no, they're still discussing, it looks like.
As opposed to doing like a.
I wonder if they can bring us closer so that we can see. I know I see that part. But if there's a way. Oh, thank you. Or at least hear the conversation somehow.
Well, we are fewer too, so it's probably easier. It was easier for us to do it. If they're doing it as a whole group, it's more complicated. Who is helping us mediating? Who is mediating this? Is that PAC? No, PAC Network must be the network name.
So that's why
in the room.
This one catches a lot. Checks a lot of boxes.
But this also has to be with highly meant for high quality chapter, not just any kind of chapter.
I think Buddy stays in the breakout room.
Early childhood
And the person, they must probably be involved in the discussion right now. I'll just text one of them. See who gets their phone first.
Or there's just one card and someone just
we're like, I was saying, just use a super art and explain such or whatever.
high quality.
Are they allowed to change that?
Free or affordable.
Free or affordable.
But
Yes.
we can just say.
So we would yeah, okay.
This is where I think accessible is just applied. Yeah, exactly. Oh, all that, yeah. That's why,
And we work very hard to say about with wages, like with high quality, well paid.
Wait, so is wages getting into a different category? I think that's a different one.
So I feel like, I think it's part of the leadership, like the response, but I also think it's on its own.
Yeah.
No, yeah, I think wages is
Interesting.
Okay. We just had a follow-up email.
That one, and there's that one.
That's like combine these.
There it is.
One has three.
I don't know about this. I think there seems to be consensus.
Yeah, you used to say like, okay, we all feel
Should the authors read their respective things? I guess we should.
They've been edited.
Well, I nominate you.
Everyone's like, I nominate
Okay. I think we have come to a consensus in this room. All right. Zoom folks, have you come to a consensus in your room? It looks like you're outside of your room. So, okay, I'm gonna ask you Zoom room to give me your, how many, what was your top? Was it 3? Was it 4? Was it 10? How many did you come?
Can you hear us? Are we unmuted?
Oh, sorry. Oh, yeah, I'll never get into that.
I still don't know. Can you hear us? Learning curve.
I don't think they can hear us.
Yeah, I will just check.
I think they can see us though. But.
Yeah, I know.
Can you hear us now?
Oh, we can. Oh.
Okay.
Wow, yay.
Can you hear us now?
Yes, we can hear you now. How many did you all decide to, what were your top however many?
I don't know. Paula, you are the Jamboard queen. Do you want to share? We're kind of a little lost. So we picked, we grouped, and then we're discussing about if we had to pick one, which one would that be? So I don't know if it will be more helpful to see the Jamboard and we cross correct now. I think we're all learning about a hybrid event right now. So how it works. Oh, we can. Someone is sharing the screen, so.
No, but what we came with were two main topics. We ended up grouping it in two main topics. We realized that for the four of us that were participating in the breakout room, there were two main problems to solve. One is data collection, how to make it democratic and involve everyone in the process. And the second one is how to get the institutions, the governmental institutions, engaged, how to present the data and the findings in a way that the government collaborates and can become engaged to come up with solutions, which until now has been a problem.
Cool. Thanks. This is what they came up with given the four of you, right? Yeah.
Yes.
So, okay, so they have their what, 8 in the pool. Thank you. Okay.
Yeah, and again, I think we can cross correct after we hear from you at the room.
As we just discussed, we chose our top 4. And since I didn't author any of them, I'm sort of the impartial person to convey them. So thank you, folks. So first, improve compensation for childcare and early education workers. And this is in no particular order. Next, lack of parent involvement in decision-making and community engagement. Third, challenge of making and measuring long-term student, family, and community outcomes into childcare and early education. And last but not least, demand for high-quality, free, or affordable programs exceeds supply. So basically, there's more demand out there than there is supply of childcare programming. This is an issue that's near and dear to my heart because affordability in this domain is my sort of hobby horse. So that is what we have.
Thank you.
Thank you guys.
Yay. That was the entire 90 minutes was just to get to a consensus of what are the priorities. Sorry, Zoom room, I'm going to move you from our screen so that I can share my screen. Where do we go from here? So I may have mentioned early on, this is experimental, like doing this process, right? It's a question mark of if this is useful for the field. I just want to open it up to all of you here, but also the folks on Zoom to like, was this interesting? Was this useful? We have some priorities. I will just give you the roadmap once again, right? And say that that's the beginning of a 4-step roadmap. So the next step would be, given these top 4, what are the actual questions we're trying to answer? Like, so turning these priorities into actual questions that are actionable. And then the next step after that would be to say, what are the resources we have to be able to answer these questions? And then the last step would be, this is something Bari offers, which is one-on-one consulting around, like, how do we get you those resources? How do we troubleshoot? If you already have a data analyst, can we just have a chit chat, right? Who's taking this on? How do we get you there? And so that's kind of the roadmap to this, is the beginning of this roadmap. I'm curious if this is interesting. Was it useful? Should we do it again? Like, I don't know. Thoughts? Thoughts from the room or from Zoom?
Oh, go ahead.
No,
I just was wondering who the target audience for this is. Who ultimately?
Can people just introduce themselves and speak so we know?
Sure. I'm Judy Shanley, and I work at the national office of Easter Seals in Chicago, and I happen to live in Boston. And I just wonder whether this process or work to develop the questions and then do a resource mapping and environmental scan of what's already out there is the ultimate goal to influence in reality what's going on in Boston in terms of the services.
Right. One question is always about, like, so let's say you do this. How do you share about it? One thing that Bari can offer, if this is interesting to you all, then we're offering this to the housing group that has also been through. So the housing group that we'll meet later today has already done this process that we just did. And like I said, if you want to see what the questions part looks like, go to the housing group later today, because they're going to do that. And what we're going to offer to folks, if that's interesting, is to just throw all this stuff up on the website. Here's what we did today. Here's, like, maybe not your names necessarily, but the organizations who are represented in the room. And these folks started this process of coming up with priorities. At one session with just these folks, these are the priorities that came up. If we do it again, we'll say, here are the priorities that this group came up with. Now in this new group, you want to add, augment, change, who else is represented in the room? The idea is to bring as many people under the tent to come to agreement that these are the priorities. And at some point, we would love to say these are Boston's priorities. Maybe we can only say these are Roxbury's priorities. Maybe we can only say this is providers' priorities, right? But we see who was in the room, and we know that they have agreed that at least these are the priorities. And that's the goal, is like we publish them, push them out, and then you can do whatever you want with them. I think I'll speak from an academic perspective. It helps my colleagues say, oh, this is what you want to know? I have a research study, I did this already. Or, oh, this is what you want to know? I want to know that too. I would like to write my dissertation on this, right? Yeah, I did.
And just from a Strategies for Children's point of view, I'm Titus, Deputy Director. I work with Amy in Strategies for Children. You know, hearing your priorities today influences our thinking with how we are convening partners in the early education and care advocacy space. And it shifts our thinking, or, you know, reshuffles our thinking a bit about what to focus on and what to do with our time as advocates. So I thank everyone for their participation. I really liked the point about parents not being at the decision-making table enough. I think that that's something we all need to figure out. So I'm glad that that came out in your work, and it will kind of put the responsibility back on people who convene and design things to think through that a bit more.
Would you want to do the question part and maybe bring friends? Is that interesting to you? Should we do that? Like, if we went and said, like, in a month from now, here's the date, everybody in this room, would you show up?
Yeah.
Yeah? Okay.
I have a comment. I don't think they can hear us.
You got someone on Zoom?
Oh, we got someone on Zoom. Do I need to do anything, or do you want to?
Go ahead, Fernando.
Oh, can you hear me? Okay. you know, for piggyback at what Titus said, for me, thinking about what the work of the Boston Opportunity Agenda, we had and as a convener at Boston, the Birthday Collaborative is, you know, the early childhood piece. So I'm thinking, oh, I want the top priorities and bring that back to VOA leadership table, but also, you know, given our connection with the new Office of Early Childhood, like just take advantage of that and say, hey, Kristen, Maxwell, here are some priorities. What do you think about them? How can the city do something about it? What is actionable at this point? Or, you know, what could be at the parking lot for the future? So that was, I think, very helpful. And in our group, I shared that I had an aha moment, because sometimes I'm wearing my hat of, you know, the professional doing this early childhood research, and then I'm wearing my hat as a parent leader. And the strength base that I bring to the table as a parent leader, embarrassed to say, it's not always in my mind when I am thinking as a researcher. So how to bring, to get the community to define what is important and help it be present at every step of the process is very interesting. So thank you for this exercise.
Cool. Thanks, Fernanda. Yeah, Rosie.
I wasn't familiar with civic research. My name is Rosie Batista, and I work at the East Boston Social Centers, and I'm the director of the Resilient Families Kindergarten Readiness Program across the entire city of East Boston. And the thing that I really love about this that I hadn't thought about, it makes me think about community-based participatory research, you know, and how respectful that process is. And you bring, like you said, bring everybody to the table for their collective lived experiences, academic and education. And I particularly like, you know, the fact that we can think about it at, I'm in a negotiations class. I'm doing a PhD at the Harvard School of Public Health, very much focused in early childhood and maternal child health, you know, and one of the things that as part of my PhD that we talk about in the global perspective is how to negotiate, you know, and how to priority set so that the WHO, the World Bank is not setting priorities for you. So this felt very much participatory for me. It felt like, you know, our voices, all of our voices were being lifted, as opposed to, you know, just certain voices with power and autonomy and fun and money, you know, which is what tends to be the case. So that's what I really liked about this process.
I think too, like, who's not in the room now? Like Zoom room, this room. We tried to really be thoughtful about it's Boston geographically, and I think, you know, as we work statewide, it's the best sometimes in Boston because there's so much, but it's also sometimes the worst sometimes because there is so much. So I really appreciate what you said, Rosie. How do we engage that kind of participation, but also then how do you follow through so people can see like that it mattered, that there was that participation? And I think that's where we're excited. It's also about flipping the script, like Jerry Robinson would always say, we have to stop inviting the elected officials and listen to them. Like we need to have events the other way where they're in the audience and we're sharing our expertise and, you know, context from the work that you're doing every day. So this fits nicely with that kind of frame. And I think in this work right now, we have an opportunity we have never had. This is my 20th year at Strategies for Children, which is bananas. Well, I'm gonna laugh or cry because we're still doing the same work that, you know, we did 20 years ago. But I do think like it's even more urgent. We've said that many times, but now is really the time. And I think this is going to be an important part of that kind of the future and kind of where we are right now when we look back as far as a tipping point. And I think we're really excited to think about how this can inform our work, but all of our work together and build connections.
We have another.
Oh yeah. Who's online?
Yeah. Can you hear me okay now?
Yes, we can.
Yes.
Oh, great. Thank you. Another group that would be great to bring to the table are youth leaders and youth voices, especially like older siblings of children who are going through an early childcare space, even if there are ways to to bring in like uncles and aunts and other networks of support, that grandparents, moving to make sure that all voices are heard who have a stake in early education and care. Even children who might have, I know it's hard for like very early education and care for those voices to be heard, but children who are in middle school and high school might be able to reflect a different perspective.
Milan, who are you?
Oh, yes, sorry. Yeah, my name is Milan Chutani. I'm joining from Vital Village Networks, which is a group in the pediatrics department at Boston Medical Center. And we focus on supporting community initiatives all around children's well-being. So parent leadership, community leadership, a lot of the topics that we're talking about today really resonate with me. And it matters that community voices are not just participating, but really leading the movement to make changes in early care.
Thank you.
Oh, I was just going to second what Milan said. That the city of Somerville, we've had success taking the systems change, a full broad systems change approach with, yes, driven by family as stakeholders, but other stakeholders as well, doing interviews with focus groups. So I second that. It's a very good point.
Well, thank you, everyone. This is only the second time this has been done with community groups ever, like truly ever, in the nation. This is a leading national model that lots of groups are experimenting with. We have in the pipeline with the National Science Foundation trying to do this in multiple cities. So I just want to put that in context for you, that like you are truly pioneering and helping us pioneer a way of engaging folks with data and research that is, as Rosie put it, right, like truly like from the ground up, which is, at least I believe, and a handful of other researchers believe, that we should be support systems, not dictators in terms of how we do our research and data work, right? So we should be there listening to you all and saying, oh, those are your priorities? Got it. Okay, how do we, I got a whole university here. What do you need, right? Like, how do we move this forward? As a person who used to work at the city of Boston, it is something that I often think about. This city has 34 colleges and universities in its footprint alone. That's not counting Cambridge. It's not counting any of the outlying Metro West, right? And so we should be at the forefront of any of these things, and we're not. And it's up to us who are at these universities to invite you to our home, to our doorstep, to our conference, and then hopefully make you feel safe and welcome, that you can participate in things like this, where we can say, oh, that's what you're looking for. Okay, cool. Let's go do it together, because we all have strengths and superpowers that we need to be able to move all of these priorities. So thank you for being part of this inaugural group. Stay tuned. I think I and strategies together will huddle after this and see like what should come next. But because you've registered for this conference, we will reach out again if there's a next step. And at the very least, we can offer, if this is helpful, is it helpful for Bari to publish the top priorities that came out of today? We can give all the context. For it. But yeah, and so we can once it's published, we can also share that out with you in case you want to point to it and say, I was part of that. So that's awesome.
You know what also be useful is over time continue to communicate with us to find out how we're using what we learned here with our respective organizations.
Yeah.
I'm at a national level. How have I used that to better our national affiliates? And I'd love to know how at a community level that's going on.
Yeah, I would love it. And if you want to talk about like how did we develop this process and like what are we learning, I'm happy to talk about that too. So like it's not my process, right? Like I've kind of made it up, but like it's gonna evolve and it's gonna change and it's gonna grow. And if this is useful to you in your own work, or not just this, then like happy to chat about like what does that look like? How do you apply this? How do you do this? I put evaluations because what's a conference without good data collection? I put some evaluations on your tables. It would be really helpful to us if you could fill them out. They can be all anonymous, totally fine. Thank you again. Thank you, online folks. Sorry you didn't get an evaluation. But yeah.
We are not. Oops. Oh, okay. My I wasn't muted.
Oh, and next is lunch, which I think will be in the ballroom.
Thank you. Nice to meet you, Teresa.
Nice to meet you guys. It was a fun discussion.
Yeah.
Bye, everyone.
Bye.
Strategies.